Welcome back. When pain makes its way into your life, you need a medical team that will help you find the right course of treatment for you. And at Innovative Medical Center, their treatment philosophy is in the name.
I have been struggling for almost 20 years with a lot of knee pain, back pain, almost chronically. I tried a lot of things. I would have to go to muscle relaxers. I did cortisone shots and PRP and coxcomb. And I thought, okay, I've got to do some exploring here. And I went to one of the seminars and had got all the information I needed, was able to ask a lot of questions. I began the program and everybody here was so wonderful, and they were able to walk along with me as I got stronger with my mobility and my range of motion and my stamina.
So great testimonial there. Joining us now from Innovative Medical Center is Randall L. Roulund. So that's a great testimonial. I have had a little bit of back pain in my life, so I probably don't know exactly what she went through, but I could imagine what it's like to live with pain. So tell us about Barbara there.
Yeah, Barbara, actually I talked to her yesterday and she was super excited that we were going to be on the show today and show that story.
Yeah.
And she was disappointed though that she couldn't come on and tape it and watch it herself because she's on an airplane going back east to go sledding with her grandkids, because now she can, and she hasn't been able to do that since they're born, and they're about this tall.
That's crazy. Okay, so you don't understand how debilitating pain can be until it happens to you. So, you know, when my boyfriend has back pain, I never believed him until it happened to me. And it's almost like it incapacitates you sometimes. Like you cannot function in daily life. So what was kind of her treatment? How did you find the right course of treatment for her?
Well, what she did is she came into the office and, of course, filled out all the paper fun. Mm-hmm. We do a very thorough consultation, then the examination with one of our medical providers and any necessary x-rays, and then our team gets a holistic approach to how we can help them with no drugs, no surgery, no steroids, none of that stuff. It's all holistic.
Okay. Mm-hmm. Yes, I have heard a lot of physicians, and I feel like I kind of fall into the same category too. Like I want to, like medicine and surgery is the very, very last option, and that has to be better than the pain that I'm going through. And sometimes that's just not always the best course of treatment. Right. So you guys do regenerative therapy.
That's right.
What is that?
Well, regenerative therapy, a lot of people know it as stem cell therapy.
Right.
But it's more than just the mesenchymal stem cells. It has growth factors, cytokines, proteins, collagen, chemokines, and hyaluronic acid. Mm-hmm. When injected into the injured area, that's the stuff that goes in there and does the healing.
Yeah.
And it's actually what creates us when we're born, when we're inside the womb as we're being made, right? For
it's your own
months.
cells, right?
No, we get it from an umbilical cord.
Oh, okay.
From a healthy, donated C-section.
Okay. How is that different than using your own cells?
Sure. As your own cells, as you age, your own cells, your stem cells, and all the things we just discussed will decrease in size.
Yeah.
And when I always like to use a chart with a circle chart. When they're born, they're this big.
Sure.
But then it goes to this big, this big, this. When you're 50, this big. When you're 80, it's a little micro dot.
Right, right.
When that dot disappears, what do you think happens?
Then you're gone.
You
disappear.
That's right. That's right. Now you're a memory on the wall, right?
Okay.
And so this gives you kind of like the fountain of youth that exists.
Yeah.
Right? And that allows your body to get rejuvenated and heal itself naturally.
Okay, so you guys are doing regenerative therapy at Innovative Medical Center. Is it happening anywhere else in Fresno? Do you see it anywhere else? Absolutely.
You can find it somewhere else. But what makes the difference between what we do and what the other clinics do is we don't just inject you and you're done. You're going to come in and you'll get the treatment if that's what we recommend, the team recommends. You're going to get that treatment. And then from there, we're going to find out why you needed the treatment to start with. And I don't mean because you tripped off the curb and sprained your ankle and you twisted your knee maybe. It's because why was your body weak enough to allow that to happen in the first place? And from there, we're going to look north and south of the problem, do a very thorough consultation, exam, x-rays like we did with Barbara, and then the team will recommend the best possible treatment plan to get your body back to as close to near normal as it will allow us to do.
So you mentioned, not everybody is going to fall under regenerative treatment. What other courses of treatment are there for pain?
You can go the traditional medicine, right, which is going to be your pain pill, your muscle relaxer, your anti-inflammatory, but we all know about the side effects that can happen. And if those don't work, then maybe they're going to go to something stronger like the opioids.
Okay.
And when that fails, they're going to do a cortisone. Like a lot of times, they just want to give you the cortisone injection when you come in.
Yeah.
And
send you on your way.
Figuring out what the problem is.
Right.
And how is that going to help you?
Yeah.
It's not. It's going to temporarily block the pain. Which then you might go do things you shouldn't be doing.
Yes.
And then that does what?
Yes, it makes it worse.
Makes the problem worse.
I have heard lots of physicians say that pain pills only make your pain worse, especially if you, like you're doing what you said there, you think you're getting better and you do things that are just going to exacerbate the pain. So if we've got people out there, they are tired of the same old way that you treat pain, they've got pain, who should come see you and how do they get set up to become a patient?
Sure, anybody that has any pain that they can't figure out what's causing it, or they're tired of doing the same old, go to the doctor, get the prescriptions, right? If you want to get your body back to as close to near normal as it'll allow, with no drugs, no surgery, then you need to give Innovative Medical Center a call.
That's what I'm chasing. I'm probably going to set up my appointment because I cannot handle this back pain anymore that happens like 2 or 3 times a year. So I'm going to come see you guys. But you guys are doing you're doing a special thing with us today. The first 25 callers who call right now will receive a free trigger point analysis. And if they qualify, they will also receive a consultation exam and any necessary x-rays for only $49 to see if Innovative Medical Center can help you like they have helped thousands of others just like you. So go ahead and call that number right now. All right. Thank you so much for being here today.
Thank you very much for having me.